Welcome to aminacademy.com. In abnormal psychology, let us discuss about parasomnia, that is a nightmare disorder and isolated sleep paralysis. Daisy could not conceal her distress from Anna, her social worker. She swallowed nervously, trying to keep the tears from spilling down her cheeks. Anna handed her the box of tissues and encouraged her to go on. 2 nights before, Daisy had experienced a terrifying and disturbing episode, waking up early in the morning with the intense sensation she was being threatened by an evil spirit and being unable to move. She could feel the heavy pressure on her chest of a spirit like a figure sitting on top of her and holding her down. She was gripping by the feeling the figure was sinister and threatening. It looked her directly in the face and was vividly tangible, transparent, smoke like, with an opening for a mouth, a head, no eyes, and a long flowing body. She felt like she could not breathe and heard a strange buzzing sound. Daisy had tried to scream and push the figure off her, but she had been fully immobilized and had felt completely panicked. She felt sensation at her neck as if the spirit were going to move inside her, cut her neck, or choke her. Finally, she came out of it. After what seemed like a half hour, but what she later recognized was probably only several frighteningly long minutes. As she became able to move, the odd hallucination faded away, but she remained shaky, jumpy, and flooded with dread for the rest of the day. This was the first time Daisy had experienced anything this horrifying, although she had been struggling with chronic, regular, and upsetting nightmares for several years. This on was something very different. Anna was alarmed by Daisy's description and privately feared that Daisy was losing touch with reality. Immediately after the session, Anna connected Daisy's psychiatrist, who decided it was time to refer her to sleep specialist. Clearly, her nightmares were getting worse. The psychiatrist set up an appointment for Daisy at a sleep clinic with Dr. Amy Middleton, a clinical psychologist who specialized in sleep disorders. Now, according to the Diagnostic and Statistical Manual of Mental Disorder, Daisy met the criteria for nightmare disorder, which is one of the sleep disorders. Sleep disorders are characterized as either parasomnias, which are abnormalities in the amount or timing of sleep, or parasomnias, which are abnormal behavioral or psychological events related to sleep. Nightmare disorder, a parasomnia, is defined by the following criteria. First one, a person awakens repeatedly from the major sleep period with detailed recall of extended and extremely frightened dreams, usually involving threats to survival, security, or self esteem. On awakening from the frightening dreams, the person rapidly becomes oriented and alert. The dream experience or the sleep disturbances resulting from the awakening causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. The nightmares do not occur exclusively during the course of another mental disorder and are not due to the direct psychological effects of a substance or a general medical conditions. Sleep is a critical important for both physical health and people's sense of general well being. Inadequate levels of sleep have been linked to problems in mood, cognition, and general performance. Further discussion. Nightmare disorder and recurrent isolated sleep paralysis or rapid eye movement REM paralysis parasomnias that cause significant distress to those who suffer from them. Nightmare disorder can cause insomnia due to fear of falling asleep through dread of nightmare occurrences. Hyperarousal and impaired fear extinction are involved in nightmare generation, as well as brain areas involved in emotion regulation. Nightmare disorder is particularly frequent in psychiatric disorders and post-traumatic stress disorder. Non-medications treatment, in particular imagery rehearsal therapies, is especially effective. Isolated sleep paralysis is experienced at least once by up to 40% of the general population, whereas recurrence is less frequent. Isolated sleep paralysis can be accompanied by very intense and vivid hallucinations. Sleep paralysis represents a dissociated state with persistence of REM atonia into wakefulness. Variations in circadian rhythm genes might be involved in their pathogenesis. Predisposing factors include sleep deprivation, irregular sleep wake schedule, and jetting. The most effective therapy consists of avoiding those factors. Now, let us discuss further detail about isolated sleep paralysis and nightmare disorder. Case studies on parasomnia like nightmare disorder and isolated sleep paralysis ISP highlights the importance of addressing predisposing factors such as sleep deprivation, stress, and erratic sleep schedules, which are often implicated in episodes. These disorders are characterized by vivid nightmares in nightmare disorder and the inability to move upon waking, sleep paralysis, inability to move upon waking, that is called sleep paralysis, sometimes which hallucinates in ISP. Case reports show that interventions like imagery rehearsal therapy IRT for nightmares and strategies to improve sleep continuity and hygiene are effective. Alongside addressing underlying psychiatric or medical conditions like post-traumatic stress disorder PTSD. Case studies illustrating nightmare disorder, high frequency in psychotic patients. Case studies show nightmare disorder is particularly frequent in post traumatic stress disorder PTSD and other psychiatric disorders. Cultural significance. In some populations, such as Cambodian refugees, the experience of sleep paralysis with terrifying hallucinations has been linked to past traumas, manifesting as an oppressive spirit or ghost figure, with PTSD symptoms increasing like likelihood of sleep paralysis. Treatment with IRT. A common non pharmacological treatment for nightmare disorder is imagery rehearsal therapy IRT, where patients mentally rehearse new, less frightening scenarios for their nightmares, which has been shown to be effective in case studies and clinical practice according to Science Direct. Case studies illustrating isolated sleep paralysis ISP. Predisposing factors. Case studies demonstrate that ISP often occurs due to sleep deprivation, jet lag, irregular sleep wake schedules, and stress, hallucination, and fear. Reports often detail intense, vivid hallucinations, that is, auditory, visual, or tactile, and a feeling of a malevolent, malevolent presence during episodes, causing intense fear and panic. An integrative approach. A case report on recurrent isolated sleep paralysis, that is RISP, emphasized the need for an integrative management approach, including lifestyle changes, psychological support, addressing underlying sleep and medical conditions, and ensuring a safe sleep environment, according to this report. Medications. While not the first line of treatment, some cases studies show that SSRIs may be helpful in ISP by suppressing REM sleep. Clonazepam has also been found effective in some instances for maintaining sleep continuity and treating parasomnias. Some key takeaways from case studies. Some important point here. Importance of lifestyle. Managing predisposing factors like sleep deprivation and stress is crucial for reducing the frequency and severity of both conditions. Psychological impact. Both disorders can cause significant distress, fear, and anxiety, necessitating psychological support. Addressing underlying conditions. Ruling out or treating associated conditions such as PTSD or narcolepsy is essential for effective management. Patients education. Educating patients and their bed partners about the nature of these conditions can alleviate fear and anxiety as well as facilitate management strategies. So far, we discussed some detail about parasomnia, nightmare disorder, and isolated sleep paralysis. We have done. Please subscribe our YouTube channel.